Okay, you're all welcome to the IMANI Reviews show. This is where we speak, we are real so that we can live. I'm glad to see all of you again today. We thank God for keeping us. Before we go on, we'd like to say a word of prayer. Father, we are so grateful unto you for this evening. We thank you for bringing us together once again. Last week you had a good time of interaction with Anita, where we learned a number of lessons. And we are here again today to talk about stroke and our health in general. We commit Teddy into your hands that you speak through him. Our bodies are your temple, and we are stewards. So help us, Lord, to take care of it well. Teach us, give us the knowledge, give us the understanding and the skills to be able to manage your temple well. We pray for everyone that you meet them at the point of their needs. Whatever questions they have, it's my prayer that by the time we end this session, they will be answered. Thank you for being with us. In Jesus' name, amen. All right. So, like I said, this is the IMANI Real Show. This is where we speak, we are real so that we can live. And today we are talking about stroke. This disease in the past was mainly known to affect elderly people. But you agree with me that these days it's quite prevalent among young adults. So I think it's in line that we are talking about it today. So whatever questions you have, whatever comments, suggestions, get them ready as we talk to Neurosurgeon Teddy Totimeh. He's been here a number of times, so we don't need to introduce him much, but for those who are joining us for the first time, he's a neurosurgeon at the University of Ghana Medical Center, UGMC.
Not at the University of Ghana Medical Center. At the Accra Medical Center.
Sorry?
At the Accra Medical Center.
Accra?
Yes.
Oh, okay. I guess I have to update my files. Okay. So Accra Medical Center. All right. Yes, so he's here to discuss stroke with us. As always, we're going to make it interactive, so we'll ask our questions as they come along. But before then, I just want to point out that we have a new link which I've sent out apart from the YouTube, and I would like to take us through slightly before we proceed. So when you click on the link, you see two options. You choose join room. I think it's on the left. So you join the one and then allow it to load, and then you click on start. Okay, when you click on start, it will open and you see us. Then you mute yourself, the camera, and then your microphone. Yes, and then whenever you're ready to talk, you can unmute yourself. It's similar to Zoom, so that's what we are using lately. Yeah, it's not very complicated, so I trust that it will work for all of us smoothly. All right, so Teddy, you're welcome once again. It's always a joy to have you. Yes, how have you been?
I've been okay. I came from a trip to Kumasi this afternoon. So
Okay, oh wow.
Otherwise, I'm fine. Yeah.
Wow. Yeah, you're really busy traveling the world.
I wish. Swear.
All right. So
yes.
Talk to us. What is stroke?
So the word stroke was chosen because every time this affliction happened, it seemed as if the person had been struck by something. Right. So that is the common term that is thrown around. It was almost as if the person had been hit on the head by, a big hammer, invisible hammer, or
Okay.
lightning had struck the person, because the person is walking around normally, and then suddenly the person just loses all control and then
Mm.
falls. So that was the reason for the word stroke. Um,
Okay.
then the more we got to know about it, the more we realized that it was as a result of the stoppage of blood supply to a part of the brain, right? So
Mm.
then the name came to be, the common name came to be more known as a cerebrovascular accident. So
Okay.
cerebral as in brain, vascular as in blood vessels in the brain. Right? So a
Okay.
cerebral vascular accident, and the accident was if we can say, the stroke part, because you can't prepare for it, you can't foresee it happening. It's just an
Mm.
accident,
Mm.
and the necessary result of this accident is that the person basically falls down as if he or she has been struck by something.
Mm.
Right. So the, because we now know it's cerebrovascular and it is not some spiritual hammer or some invisible lightning or some witch's broom, or right. We now know that it is blood supply to a part of the brain that is
Mm.
stopping suddenly. Now, this can happen either because the blood vessel is blocked, in
Mm.
which case we'll call it an ischemic stroke,
Mm.
or the blood vessel has burst or ruptured, which
Mm.
is what we call a hemorrhagic stroke. So an
Okay.
ischemic stroke means that the blood vessel is blocked by a clot,
Mm.
and blood does not go to a part of the brain. There's a sudden stoppage of blood going to a big part of the brain, right?
Okay.
And then the person loses consciousness. So that's the ischemic stroke. The hemorrhagic stroke, the blood vessel that is supposed to be going to a part of the brain ruptures. So instead of the blood going to the brain cells, it goes into the area around the brain cells, and it's the same consequence. A part of the brain loses blood supply, and then then the brain loses function, and the
Mm.
person falls or loses consciousness. Yeah.
Okay. Wow. That's quite serious. The one that ruptures, this is the same as the aneurysm.
Well, an aneurysm is just a blister in the wall of a blood vessel,
Mm.
right? So if you had a weakness in a part of a wall of a blood vessel, then you would call it an aneurysm. So if you have a blister in the skin because that part of the skin is weak, then you have that part of the skin bulging out, right? Just
Mm-hmm.
like if you've had a burn on the skin, right? That
Mm-hmm.
part which is burnt becomes thinner, so
Mm.
the skin bulges out, and you can see some fluid that if you put a pin into the blister, the fluid comes out, right?
Mm.
It's because the skin no longer has the function of holding the tissues in, right?
Okay.
Because it's been hit by the burn, right?
Mm-hmm.
Now, something similar happens to the blood vessel. Eh, So, for some reason, the blood vessel wall loses its strength, and that
Mm.
part of the wall bulges out. And it's that
Mm.
bulge that we call an aneurysm. Right?
Okay.
So, now sometimes an aneurysm can result in a stroke
Mm.
because you have a weakness in the wall,
Mm-hmm.
and then that weakness in the wall means that it cannot hold the pressures that the normal blood vessel can hold.
Mm.
So that weak point in the wall rushes, and then you have a stroke that is happening because of an aneurysm, right?
Okay.
But most strokes do not really happen because of aneurysms, but we'll go into the causes of those strokes.
Yes. So we can go there now. What are the causes?
So the more common strokes would be the ischemic stroke, which
Okay.
is where you have a clot blocking blood flow to a part of the brain, right? Now, you can either have the clot blocking the, if you were to refer to a blood vessel as a tunnel, right? And we have something blocking the tunnel, it will prevent, whatever passes through the tunnel from going through, right? Right. So you can either have the wall of the tunnel growing thicker so that there's no space for something to pass through, or you can have a clot from somewhere blocking the tunnel.
Yeah.
Right. So what normally happens is that a blood vessel wall becomes thicker and thicker and thicker until nothing passes through. That is the more common way in which a stroke happens.
Okay.
Right? The ischemic stroke happens. And then the less common way is that a clot is coming from somewhere in the body and goes to block that blood vessel and then causes a stroke. That's the less common way, right?
Okay.
So let's do the more common way first. And now we're talking about ischemic stroke, right? So, and we're doing the more common way first, where we're saying that the wall of the vessel is thickening, right?
Yeah.
It's thickening to the point where suddenly blood cannot go through, right? Okay. So, the last time we talked about hypertension, right?
Yes.
And the key thing about hypertension we said was that, under normal circumstances, the heart is supposed to be pumping blood to muscles which need it, right?
Yes.
So now we're sitting more of the time, we're not using the muscles, but the heart does not listen to what the body is not doing. It will work according to what the body is supposed to be doing, right? So, there's a situation where, first of all, the blood vessels know that the pressure of the heart is not going to change, right? So, when you were late for school, right, in those few years ago, when you'd be going to primary school and you'd be late, and you knew that, and you knew that when you reach school, there's something going to happen. What would you normally do to prepare for that something that's going to happen?
Like the caning or the wheeling.
Yes, the caning. What do people usually do
Or some will
to prepare for the
pad
caning?
their backside.
Exactly.
So that
Yes. So they'll put exercise books there, and then and then the teachers who were very used to students' antics would usually tell you to remove the books before the lashing begins. So that's what the blood vessel does. The blood
Okay.
vessel knows that the pressure that it's going to have to withstand is significant. So, under normal circumstances, the blood vessel wall is elastic. So, when the blood comes, it will expand to accommodate the pressure of the blood, right? However, the blood pressure has been increasing steadily, and at one point it says, okay, I'm expanding, nothing is happening, and the pressure is not coming down. So what am I going to do? I'm going to stiffen my wall
Okay.
so that I can withstand the pressure. So some chemical reactions happen that cause the normal collagen in the blood vessel to change their nature and to change the bonding between them, so that instead of the blood vessel being elastic, then the wall becomes plastic. So instead of having, like a balloon where you can pump in water and then the balloon will expand, suddenly you have like what can I use? A football, right? Tougher,
Yeah.
and you can only pump to a certain extent, and it will hold, but at one point it will rupture,
Yeah.
right? So you can imagine that the elastic wall is much more resistant. It's much more accommodating of pressure than the plastic wall.
Okay.
Right.
Yeah.
So the impact of high blood pressure is to convert the blood vessels in the brain from having elastic walls to having plastic walls. Now, the thing about plastic walls is that they can withstand a bit more pressure without expanding, right? But the amount of pressure that they can withstand without rupturing is lower. So they become plastic, withstand the pressure, and then one day a tear happens, and then that is where you have breaking the blood
Blood
vessel,
vessel.
and then uh, you have the blood vessel rupture. Okay,
Okay.
but before this is happening, first of all, you're just having a thickening wall in order to withstand pressure, right? So, apart from the wall becoming thick, the body is also used to a certain amount of, carbohydrates.
Okay.
What the body does with carbohydrates is to create energy for muscles to use so that the muscle can do work, right? Unfortunately, we're sitting a lot, not doing much, so there's a lot of unused energy, right? But in the body, there's nothing like waste. So when the body sees that a lot of the energy is not being used by the muscle, tries to save the energy for a rainy day. So how does it do it? It converts the carbohydrates into fat.
Okay.
Right. Now, fat now is going to be stored in different parts of the body, right? So that it can be used when there's no food. But in our circumstances, there's not going to be a day when there's no food. So,
The
so
rainy day won't come.
the rainy day doesn't come. The fat continues to be stored in different places until there's no really anywhere to store the fat. And so then you have a little more fat in the blood than there should be, right?
Yeah.
So blood is floating in fat is floating in the blood in terms of, the the small um, components that are used to make fat. So you have triglycerides, cholesterol, they're floating in the blood, and they also have nowhere to go, right? So they start depositing on the insides of these blood vessels, which have already become plastic, right? So now you have hardened blood vessels, and then you have accumulating cholesterol and triglyceride compounds on the inside of the blood vessel.
Okay.
So this is what we call an atheroma. So this thing we call atherosclerosis is just accumulation of byproducts of blood and fat and cholesterol in the wall of the blood vessel, right?
Okay.
Now you can imagine that this is accumulating layer after layer after layer after layer. And one day, from a tunnel that is big enough to accommodate one human being, suddenly the tunnel cannot even accommodate a mosquito because it has grown. The hole has grown smaller and smaller and smaller and smaller and smaller. And sometimes the atheroma can form so completely that it completely blocks the tube.
Yeah.
And apart from that, apart from just blocking the tube, sometimes it can dislodge along the tube, right? The bigger part of the tube. So there could be a bigger part of the blood vessel where it's blocking just about maybe 1/3 or maybe half of it. So blood is still passing through. Then this atheroma just dislodges and is pushed by blood further down the blood vessel to a narrower part. And when this happens, it blocks the narrower part completely. And that's where you have the stroke. So this is the more common pathway.
Okay.
Right? Somebody's sitting and eating normally, food is not being used to produce energy, body starts saving up for a rainy day. Rainy day never comes, so there's an accumulation of fats in the blood vessel, and then it lodges on the inside of the blood vessel and narrows it until blood cannot pass through. And then right. So about the ischemic stroke.
Okay.
And we've been talking about the more common pathway for the ischemic stroke, right? And clear for that pathway.
Yes, it's clear. I have one question before you continue.
Right.
So from what you said, it means that if you are active, like you're consistent with your physical activity, it's not likely that you get a stroke this way.
Exactly. So if you're active, then what it means is that the likelihood that you're going to get fat and components of fat and byproducts of fat and breakdown and all that floating in the blood and getting atherosclerosis and things like that is much lower. So because first of all, you're not even going to store fat because you're using the carbohydrates for energy very effectively. Right?
Yeah.
So for somebody who is in his 20s, right, who is, active, the likelihood of getting a stroke is very small. Right?
Okay.
Whereas for somebody who is 60, right, and has done a lot of work, is now, flying all over the world, is moving less, is sitting in the office, is, coming home late and things like that, and too tired to do any exercise and things like that. I'm preaching to myself. Yes, but right, but but that kind of behavior, that pattern of behavior, means that you're more likely to have, byproducts of lipid, that's fat metabolism, cholesterol metabolism in the bloodstream that will accumulate slowly and slowly narrow the blood vessel until a part that is going to a significant part of the brain is blocked. And here you have that.
Okay. Then it means that the generations after us, they really need to do a lot of work, because it's interesting. Just today I was thinking back to my childhood, how active we were. I think I watched a video and someone was it was something about those times when there were no mobile phones. The kind of things we were doing, we're very active. And I was thinking of the current generation and thinking that they are so immobile, so something really has to be done.
Use virtual reality to simulate, kung fu, simulate running, simulate, so they actually have the opportunity to be even more active than we were,
Okay.
especially if they are more willing to do that. Yeah, but definitely yes. And the scope of activity that we had will be missing on them, and it can also impact socially, because the kind of coping skills, human coping skills, and social coping skills that you learn from just walking down from your house, going to the football field, meeting a random group of people who are playing soccer, and then you say, "Hey, me too, I want to play," and
Gata to
then you
gata.
are able to, have a conversation
Yeah.
with total strangers
Yeah.
that that enables them to allow you to start playing with them. That sequence of activities that leads to better abilities to cope as human beings in a community, yes, can be lost in the
Yeah.
current environment.
Yeah. Okay. So the next one is the hemorrhagic stroke.
No, so we haven't finished with the ischemic
Oh,
stroke. We
okay.
talked about the more common
The
pathway
common.
for the
Okay.
ischemic stroke, right?
All right.
But the more the less common pathway for the ischemic stroke is that the clot could be coming from somewhere. Right? Now, blood is supposed to be moved around. If blood is not moved, then blood cells start settling, and then you have clots forming. Right? So if blood is not moving, it will form clots. So as soon as blood leaves your body and comes out, you can see if it sits, it will start forming a clot. That is just how blood is, right? So if blood is not moving where it's supposed to move in the body, it can't form a clot. So sometimes when you have heart problems where the heart is beating not as efficiently as it should beat, right? Under normal circumstances, the heart goes through a very, structured way. It brings in the veins bring in blood, the heart beats, so the heart expands to allow the blood to come in, and then when the blood has come into the top part of the top part of the heart pumps into the bottom part, and then the bottom part of the body, the heart pumps so that the blood now comes out.
Yeah.
Now, it's a very well regulated rhythm. One contraction must happen after the other. Now, if those contractions are out of sync, then the heart is not able to pump like it should. So, if the rhythm is lost, then instead of the blood coming to the heart and then just leaving to other parts of the body where it's needed, it stays in the heart, right? So once it stays in the heart longer than it should stay,
Yeah.
then it starts forming clots. And then what happens? Those good times when the heart really pumps well, then the blood leaves the heart and goes with a clot into the brain. Now, that clot will then go straight into a blood vessel, block it, and then we have the same ischemic stroke.
Ischemic.
Right. Okay, right. So that's the less common way,
Okay.
right? So again, this is sometimes because of hypertension, the heart has been, has not been getting enough. The heart gets its own blood supply and its oxygen supply when it relaxes, right? So that's when the heart muscles are fed. Now, if the heart muscle is pumping too hard and too often, then it means that there are times when the heart muscle will not be fed. So parts of the heart muscle start dying, right?
Okay.
When that happens, then the heart is not able to pump effectively. The rhythm is lost, and then you start developing blood clots in the heart. And then when the heart pumps, the clot will go into the brain and block a blood vessel, and then you have a stroke.
Yeah.
Right. So again, it can happen with hypertension. It can happen with different heart diseases that occur to affect the rhythm of the heart pumping.
Okay.
Right. So the most common one is what we call atrial fibrillation, where the heart, instead of nicely pumping, with every beat, is just fluttering, in between beats and not pumping effectively, right? So these are the key ways in which ischemic strokes are formed. Right? So now we can go to the hemorrhagic strokes,
Yes.
which are less common, right?
Okay.
So ischemic strokes are common, but they don't kill usually. Ischemic strokes will make somebody paralyzed on one side and will make somebody maybe stop talking and will make somebody have to do physiotherapy in order to get back to some life. But usually ischemic strokes do not kill. Now, hemorrhagic strokes kill, right? So if a hemorrhagic stroke happens to 10 people, 5 people don't make it, right?
Wow.
Whereas if an ischemic stroke happens to 10 people, usually only one person would be, affected enough to lose life, right? So the hemorrhagic stroke, I mean, we're talking about the blood vessel becoming plastic, right?
Yeah.
Okay, right. So that plastic blood vessel is now an abnormal blood vessel, right? With an abnormal. So again, let's split it into two so that we'll talk about the more common one, which is the blood vessel becoming plastic, right? And having a segment of the wall that is abnormal and which cannot expand to, accommodate certain blood pressures. And then one day you get a high blood pressure, and then the blood vessel just ruptures because it's taking enough punishment.
Yeah.
So that is the hemorrhagic stroke, right? The blood vessel has ruptured and blood has gone into the substance of the brain.
Yeah.
Now, under normal circumstances, have you seen a brain before?
Not physically.
But when you see it in pictures, how does it look like?
It's red and it's partitioned and
Is it actually red?
well,
You've
from
seen
what
a
I
red
see,
brain
or
before.
pink.
It's like more likely pink, right?
Pink, okay.
Right.
And
Because
it's
the liver is red, right?
okay. It's a liver I haven't seen.
Liver is. Oh, you haven't seen liver? No, you've eaten chicken liver before.
Well, that's dark red, or
Yeah, that's dark red.
okay.
Yes.
Okay.
That's
So it's the
dark
same
red.
with the human
Right.
liver.
It's the same with the human liver. It's the same.
Okay.
And the brain and the liver basically take the same amount of blood.
Okay.
Right. But the brain is pinkish and then the liver is dark red.
Okay.
Because the brain is pinkish because there's what we call a blood-brain barrier.
Okay.
Right? So the brain is an electrical organ. Right? You cannot expose it to blood.
Oh.
And
wow.
yet the brain cells need blood in order to survive, right? Okay. So can you imagine, would you put water on your laptop? Yes, I mean it's the same way because the laptop is full of circuitry, right?
Yeah.
A lot of circuits come together, right? The brain is also a collection of circuits, right? And these circuits must be kept in a very controlled environment, right? And so liver cells can be in a situation where they're completely surrounded by blood, and that is why the liver is red,
Okay.
deep red. But brain cells cannot be in blood. Brain cells have to be isolated from blood,
Okay.
and that is why brain is pink, right? The pink is just the blood vessels, roaming around in the tissue. But if you separate the brain from the blood, so you see that the brain is actually white. It's
Oh.
actually, yes. It's only the blood the blood vessels that is making it pink,
Okay.
right? But the brain tissue itself would tend to be more on the whitish side. So, in neuroanatomy, we divide the brain into gray matter and white matter, right? Because when you take the blood away, that's how it looks. So, what happens during a stroke is that suddenly the brain cell becomes like the liver cell. It has been completely surrounded by blood.
Yeah.
And the brain cell cannot function like that. It's just like a computer that you poured water into. The computer will stop working.
Yeah.
Right? Yeah. So that's what happens to the brain during a hemorrhagic stroke. And that's why it kills so easily, because you give the brain a significant shock, right? You surround it completely with blood that it is not used to, right? And there's an overreaction, there's significant swelling in the brain, and then that is what causes the brain function failure. So the more common type of hemorrhagic stroke will be that caused by the blood vessel becoming plastic and then rupturing, right?
Yeah.
And then the less common kind of hemorrhagic stroke would be what you alluded to initially, caused by an aneurysm, where you have a blister in the blood vessel wall, a weak point, then rupturing, and then causing the hemorrhagic stroke.
So those who are able to survive, how does that happen?
So with the ischemic stroke, those who are able to survive, usually the care they need is supportive care. Supportive care means that we have to make sure that the person is breathing, and then we have to make sure the blood pressure is controlled. We have to make sure the person is fed, and we give the person oxygen, and slowly support the person until the brain slowly reorganizes itself, and then the body starts responding, and then slowly rehabilitation sort of brings back some kind of function, right? Now, in hemorrhagic stroke, there is more likely brain function failure, brain swelling, compromise of breathing, and so the patient needs to be seen and treated and supported in an intensive care unit. So most people who get ischemic stroke will not need intensive care.
Okay.
But the 50% who survive the initial hemorrhagic stroke, we lose most of them if we do not get intensive care for them.
But some of them are able to recover from the intensive care.
So with intensive care and sometimes surgery to remove the blood clot that is occupying space and reduce the brain swelling, and the people are able to survive.
How long does that usually take?
There are people who had hemorrhagic strokes like 2-3 years ago and have still not recovered.
Wow.
They're alive, but their function is significantly depressed. And then there are also some people who I've had patients who have had hemorrhagic strokes and did not need surgery, right? Slowly they were able to recover and function and are able to be, you know, productive in society. They never reach their full function, but they're able to be productive. And then there's some who, you know, will be weak on one side for the rest of their lives, and some who will never talk for the rest of their lives, and some who will be dependent on care for the rest of their lives. But in medicine we have morbidity and mortality,
Yeah.
right? Morbidity would be the loss of function that prevents one from getting back into society as a functional human being, right? Whereas mortality is death, right?
Yeah.
Okay, right. So the morbidity for hemorrhagic stroke is high, and the mortality is high, right? For ischemic stroke, the mortality is low,
Yeah.
but the morbidity is high,
It's high.
right?
Yeah. So, how about transient ischemic? Is it
Attack.
attack? Yes.
Yes. So a TIA, transient ischemic attack. Now, if you were to think about it in football terms,
Okay.
right? A stroke is a red card. A TIA is a yellow card.
Okay.
Right? So when the referee shows a yellow card, he stops the person from playing and shows the person a warning.
Yeah.
And then the person can go back to playing, right? But when the referee shows a red card, he stops the person from playing and the person cannot go back onto the field,
Yeah.
right?
Yeah.
So in the transient ischemic attack, everything has happened like I've described in an ischemic stroke. However, for some reason, the initial blockage releases and blood flows again.
Okay.
And the person who was weak on one side because of function loss in a part of the brain regains the function, usually in 24 hours.
Okay.
Whereas for the person who's had a stroke, the function never returns. Or will return slowly but incompletely.
Okay.
But in a TIA, all function comes back.
Okay.
So the transient ischemic attack is a warning.
Okay.
It's a warning that you've had the blockage of a blood vessel, but the blockage has reversed. But it means that there is the possibility of developing a stroke.
Yeah. Okay. Thank you. One more question, then I'll see whether there are questions online. What causes the blood clot that causes the hemorrhagic stroke?
So, I was telling you the hemorrhagic stroke, you have the blood vessel rupturing. And so the blood is supposed to stay in the blood vessel, keep in its lane, and then, processes allow, oxygen, glucose, and nutrition to the brain cells to go across the barrier, right? The blood-brain barrier. So if you were to say the blood is running in the tube, there's a barrier, and then there's a brain cell. And there are mechanisms that allow oxygen and then nutrition to go from the blood to the cell, right? And the blood will never go to the cell directly. Uh-huh. However, when the blood vessel now ruptures, then blood just vessel and goes into the area around the brain cells. And this is where the chaos is from, because the brain cells are not even having blood around. So what do? They react, they swell, they lose function, and there's a complete shutdown of function. Right? So yeah.
Okay, so I was actually referring to the cause of the hemorrhage. You mentioned earlier that there's a dislodging of a blood clot and then it goes to block the vessel.
Oh no, that's ischemic.
Oh, okay.
Yeah, so a clot blocking a vessel, that's under ischemic stroke.
Okay.
The hemorrhagic is just a blood vessel bursting and then blood going out of the blood vessel into the area of the brain cells.
Yes. But I thought the rupture was as a result of it's being blocked over time and then...
No, the rupture is actually that hardening of the blood vessel wall.
Okay.
Making it plastic. And making it incapable of resisting pressures.
Okay.
And then just given up by bursting.
Okay. Okay. That's clear.
Or the less common route is forming an aneurysm and then the aneurysm also rupturing.
Okay.
Yes, because it is the weaker part of the womb.
Okay. All right, let me go to YouTube and see if we have any questions before we proceed. Okay, we have a comment. Kakraba Afol says, "Thanks, Dr. Totimeh, for the education. Very informative." All right.
Thank you, Uncle Kakraba.
I don't see any comments yet. All right, so I guess we can proceed. So in terms of prevention, we talked about physical activity.
Yes.
Okay, what else can we do to prevent such accidents? Okay.
Yeah, with physical activity, we answer all the issues. I mean, of course, treating hypertension if we have it, right? We must make sure that if we have it, then we should make sure we're taking the medications, because the more the body gets used to high blood pressures, the more plastic the blood vessels will become. And the more likely it is that, the more...
Can you hear me? Hello?
Hello.
Yeah, I can hear you.
Hello, can you hear me?
Yeah, I can hear you.
Okay, sorry, I think I pressed the wrong button. Right.
Okay.
So then the more likely it is that the blood vessel will become plastic and then rupture. So if we have hypertension, we should make sure it's being treated. Now, at the moment in Ghana, we unfortunately have a high rate of hypertension amongst young people. Right? And which is why we also have a high rate of hemorrhagic stroke amongst young people in Ghana. And unfortunately, it's because we have failed as far as our primary care system is concerned, and we're not able to treat the hypertension. We're not able first of all diagnose the hypertension, and therefore we're not able to treat the hypertension. And sometimes the only time young people realize they have hypertension is after they've had a stroke. Right. So, I mean, if there was a way to prevent a stroke, it would be, having a very active lifestyle, having a supportive primary care system which is able to check our blood pressures and diagnose hypertension and start treating before it gets bad. And then that's it, basically. Yeah. For ischemic strokes, the thing about just, for example, diet. If we combine a very good diet with a very inactive lifestyle, then we have the situation where you have, the components of fats and fat metabolism in the blood vessel, and then you have the atheroma forming, the thickening of the wall, and therefore the blockage, right? And so that's the thing. But of course, if diet is in moderation, activity is happening, then you can imagine that the likelihood of this causing, problems is very small.
Yeah. Okay. So, how about care for those who have had it? I know that there are some who tend to recover quicker than others.
Right. Right. So imagine that, first of all, the blood vessel that was blocked was a small blood vessel. Right.
Okay.
So, you know, for a lot of people, what happens is that it's the small, very, very, very small blood vessels that get blocked. So they get very, very, very small strokes throughout their life, and it's of no consequence because the brain is very it has a lot of redundancy, right? It's like having a computer with let me say um, I mean, supposing you Abby had a computer which was 5,000 terabytes, right? The likelihood that you're going to use that 5,000 terabytes completely, even with all the videos and everything, that likelihood is small, right?
Yeah.
At the moment, if you were to put all your videos together, maybe it would be like 2 or 3 terabytes, right? But 5,000 or 10,000 terabytes, you would not be able to use. But the thing is, if you had a problem with a part of your hard drive, which is about 20 terabytes, then because you have 5,000 terabytes, that problem would not manifest in a big way, right? Right. So it's the same thing that happens for the brain. For most people, the strokes will be very small and happening over their lifetime with no consequence. It's only when we take an MRI of somebody who is now in his 70s or 80s and has had hypertension for a long time that we can see on the MRI that they've been small strokes over the years, but nothing has happened like that. Right. So, but the one that we talk about as a stroke is what we see, right?
Yeah.
And okay, so how do we take care of such people? And for the person who has had an ischemic stroke, when it happens, in Ghana, we don't have anything else to offer apart from what we call supportive care. Right?
Okay.
Supportive care would be that we make sure that they're breathing okay, we make sure they're getting enough oxygen, we make sure they don't swallow, they don't breathe in something that is in their mouth so that it can cause a pneumonia, right? And then we also make sure that during the time when they are incapable of looking after themselves, we're getting an NG tube in to feed them,
Okay.
and slowly support them until they're able to take care of themselves.
Mm.
There is one center in Ghana which is offering the new technology that's available for ischemic strokes. Now, imagine that we understand the problem of an ischemic stroke. We know it's a clot, right?
Mm-hmm.
So, if you were able to get to the clot and remove the clot,
Mm-hmm.
then you can convert what would have been a proper stroke into a TIA, right?
Mm. Mm-hmm.
So now we have the technology that is able to convert all strokes into TIAs.
Oh,
And
really?
you know that TIAs are reversible, right?
Yeah.
So if you are able to convert the major stroke into a TIA,
Mm-hmm.
then you can reverse the stroke,
Yeah.
right? Right. And the thing is attacking the clots,
Mm-hmm.
right? Okay. So there are a few centers in Ghana, especially in the teaching centers, where the clot is attacked in one way. And that is by giving a medication that would melt the clot,
Mm.
right?
Mm-hmm.
So it's called a clot. It goes
Mm.
into the blood, and as soon as it finds the clot, it breaks it down,
Mm-hmm.
right? So that basically the blockage reverses,
Mm.
right?
Yeah.
However, however, we can't the clot buster just for that clot. So wherever this clot buster finds it will best
Mm.
it, right? And and if the person was, bleeding from somewhere and the bleeding has stopped, this clot buster can
Mm.
restart the bleeding,
Mm.
right? Okay, so that has to be done in the teaching hospital. It
Okay.
has to be done in a very well structured environment, so that
Mm-hmm.
if something is going wrong,
Mm.
there can be intensive care support
Yeah.
basically immediately, right?
Yeah.
Okay, so that is one way. So that is if I can say, the gross way,
Mm-hmm.
right? Gross way, because it's like how, excuse my
Oh,
excuse my
French.
my no my example, the example I'm going to use,
Okay.
but it's just like how the Israeli Defense Force is chasing the
Mm-hmm.
Hamas, right? They're bombing all the tunnels,
Mm.
bombing the whole Gaza, so
Mm-hmm.
that they can, constrict this, you know, this threat,
Yeah.
right? And right. So that is what a clot buster does. It
Mm.
just injected into the bloodstream, looks for anything that looks like a clot
Mm.
and busts it, right?
Mm.
So it can cause bleeding in different parts of the body and things like that.
Mm.
However, we always look at the risk benefit ratio,
Yeah.
and we say that, okay, because of the possible benefits, the risk is worth taking,
Mm.
right? So you can imagine that this would be given only in the first 24 hours, because we
Mm.
said that most TIAs would revert within the first 24 hours, right?
Yeah.
So only in the first 24 hours is this kind of treatment starting. And actually, it's even tighter. Generally, after 8 hours, nobody will give this treatment.
Mm.
So usually, it's in the first 8 hours after a stroke,
Mm.
an ischemic stroke,
Okay.
that this is done, right? Now, that is the gross way.
Mm-hmm.
Now, the more targeted way is going with, how do I say it? If you wanted to catch a specific fish,
Mm-hmm.
right, in a specific river,
Mm-hmm.
right, you would go with a net shaped for that fish,
Yeah.
put it where you think the fish is going to be, and then catch the fish, right?
Mm-hmm.
right? So there is the targeted way of looking for the clots, where the blood vessels in the brain can be seen on X-ray, right? We inject what we call a contrast into the blood vessels. We can see exactly where the blood is, where the blood vessel is blocked, and then there are ways in which you can put what we call a catheter. It's a very,
Okay.
very, very tiny tube. It's passed into the blood vessel all the way into the brain, all the way into the blood vessel that's blocked, right? And then there's a specific miniature micro net that is also passed there to trap the clot and bring it out.
Wow.
Now, this type of treatment is very specialized treatment. It's done in a lot of big teaching hospitals in the US, in the UK, in the developed world, right? And there's been a lot of training for this. In Ghana, there hasn't been much of, we've been concentrating more on the V8s than anything. So we haven't done as much training as we should to make people capable of using this equipment. So it looks like we have just one center which is offering this care,
Oh,
right, at the moment.
okay.
And there are only maybe one or two people in the country who can do this kind of treatment
I'm sure it's expensive.
too, right? So for a country of 33 million people, this is almost the same as not having the the technology. But it is important to point out that it is available in the country at the moment, even though it's just one center and just a few people who can do the procedure. So when it comes to ischemic stroke, I've said that we can give supportive care, right? Make sure the person doesn't get worse. Make sure we can support the person until the person comes out. Or we can actually attack the clots.
Yeah.
You can attack the clots by going, with all guns blazing, and or you can go targeted and look for that specific clot, take it out. And I've been in centers where that has been done, and on the table, the person lifts up the hand that was weak. Yeah.
Wow.
And yeah, and you can imagine that if a country invests into this kind of technology,
Yeah.
it immediately converts a lot of what would have been permanent strokes into transient ischemic attacks.
Yeah.
And it converts a lot of people who would have been paralyzed on one side into people who are completely functional, right? But in order for this to happen, there must be investment in training and there must be investment in equipment. Yeah. And this has not happened yet in Ghana. Now, for the hemorrhagic stroke, most of the care is supportive, but this is intensive supportive care, because usually in hemorrhagic stroke, the loss of brain function is so significant that the person has to be supported fully. So being supported fully means that the airway of the person is taken care of. So a tube is passed into the trachea of the person, and then the person is connected to a ventilator which breathes for the person, right? The feeding for the person is taken over. The management of the kidneys, the liver, and everything is taken over. So until the brain function returns. Now, and then if the hemorrhage is big enough, then neurosurgeons also have to come in to take out the clots and reduce the burden on the brain. And this gives the person the best chance of recovering.
Can you hear me?
Yes, I can hear
Okay,
you.
great. So,
So I've talked about treatments. I've talked about treatment for the ischemic stroke, and I've talked about treatment for the hemorrhagic stroke.
yeah. So, in Ghana currently, what are the what's the, how do I say it, the success stories? Are they more than the other side, so to speak?
First of all, in Ghana, the key thing for Ghana is that please let us not get the strokes, because we're just not prepared as a country for strokes. Right? We are neither prepared for ischemic strokes nor for hemorrhagic strokes. For the ischemic strokes that do not kill, that have just a high morbidity, we need people who are able to support the person initially. We don't have enough doctors to do that. We don't have enough nurses to do that. And after the person has recovered and needs to be supported with rehabilitation therapy, we don't have enough. We don't have enough physiotherapists. We don't have enough rehabilitation outside the hospital. There's so many people who make it outside the hospital and cannot even get simple physiotherapy that prevents their limbs from becoming stiff, right? Sometimes people lose the capacity to speak. We need speech therapists. I can count the number of speech therapists in Accra on my fingers.
That's true.
Right? We do not have enough. We need occupational therapy to teach people how to use the spoon to eat, how to write. How we have so few occupational therapists. So as a country, we are in no way prepared for people to have strokes. So the best way would be that we do the things that would prevent the strokes from happening. Because once they happen, then this country is not a good place to be.
So, how well do you think we are creating awareness about this, especially the preventive bit?
I think, I saw an advert just before I got on this. I saw an advert made by my colleague neurologist, Dr. Glover, and she is talking about stroke in a webinar. I've seen multiple webinars where people are talking about stroke. So some of this is going on. But the thing is, webinars have a very restricted audience.
They do, yeah.
We can get on YouTube, we can get it, but the only way to get this is, a country having a policy that says this is a problem, and we're putting together people who can give ideas on how to solve this problem. And we're going to compensate them. We're going to enable them financially to achieve something that creates the publicity for this problem. Now, if we were to make hypertension treatment free in Ghana, it would prevent a lot of strokes. Right? If we were to say that, we're going to have a policy, we're going to screen everybody for blood pressures, we're going to catch people in the barber shops, in the markets, even in the beer bars, right? And in the and the antimony watch it please, the big time banku places, all the fufu complexes and headquarters dotted around dotted around the country. If we were going to check blood pressures and screen people, I mean, we would prevent a lot of strokes.
Yeah.
We just it's not rocket science, but it's something that has to be done as a country,
Yeah.
and as a system. There's only so much one can do as an individual.
Okay. Well, I've seen a few questions on the YouTube, so I'll read them. Before that, Uncle Keiko Hinedu says, "Thanks, Doc." And then Joyce Ochena says, "Doc, please, can you recommend food that will help lower blood pressure instead of constantly taking these hypertension medication?"
Unfortunately, I can't. You know, the thing about food is, what is my moderation is not somebody's moderation. and the truth is, we can say stop eating meat. We can say stop salt. We can say even stop chicken, and all that. But truthfully, it's all about moderation. If we're careful about how much we eat and we're active, there's really no reason why food should be limited. I'm not a dietitian, so I'll not be able to take over what a dietitian would say. However, ultimately, we just need to be moderate in our intake and decisive about our activity.
Yeah. Well, what you said is not far from the truth. We've had a few nutritionists coming on the show, and they talked about the 4 quadrants, I should say. So when you're eating,
Right.
you have the veggies, the protein, the carbohydrate,
Right.
and then
Right.
the 4th one was that. I'm blanking out, but yeah.
The fats.
Fats,
Okay.
yeah, I think.
Right. Something like
Yeah.
that. Okay. Right.
So it's exactly as you said it. Everything in moderation.
Right. Right.
Yeah. All right. We have another question. Najako says, apart from activity, does taking water help reduce the likelihood of one getting a stroke?
No, it doesn't. It's good to be hydrated. It's good to make sure that your kidneys are functioning well, and being well hydrated also means that generally your function in terms of your bodily functions and your brain functions are kept as close to normal as possible. But being hydrated would not prevent a stroke. I'm sorry.
Unfortunately. Okay. KK again says, what is your recommendation for a patient with high cholesterol levels? And sorry, there's something blocking the rest of the comment. And the associated risk of stroke.
So, we talked about cholesterol and the impact it's having in narrowing the blood vessel, and the possible way in which it can cause an ischemic stroke. Now, for high cholesterol levels, there are specific medications that bring down the cholesterol. So they're the anti-cholesterol medications that have been around for quite some time. And I know that for any physician who would see that the cholesterol level is high, the person will be put on some anti-cholesterol medication.
Okay.
And yes, so that would be it. And then of course the dietitian would come in with um, dietary advice on low cholesterol foods that should be aimed at, so that the problem cannot be made worse.
Okay, thank you. I think that was the last one. What's the time? We have about 6 minutes more. For those who joined using the second link I sent, there's a place for chats, so we still have a bit of time. If you want to type something, I'll see it and then I'll read it. In the meantime, we'll continue. Yes. So, is there anything else we need to know about stroke?
Yeah, so the thing is, in our environment, strokes are affecting young people, right? So between 15 and 45. And these are the most productive age groups in our environment, And Ghana is, 50% under 18. So you can imagine if you have, and the tragedy of strokes in young people is the fact that they have all their lives in front of them, and that is loss of potential capacity to give something to society, and they become a burden on society. And already we do not have our healthcare situation sorted out. Um, we don't have a health insurance system that is covering a lot of disease, and we do not have a very supportive. I mean, sometimes even getting access to public buildings with a wheelchair is a problem.
Yeah.
And getting like outside when you're going to a bank, I mean outside the country when you're going to the bank, one of the things that is required is that you have a handicap accessible door. Not even the parking lot, the door to get into the bank. Right? Something that somebody who is sitting in a wheelchair can actually pass through the door to enter. So all the person has to do is come in front of the door opens, so that, and the door is big enough so that a wheelchair can go in, and there's specific, when you go to a restroom, some in some restrooms outside, I don't go to the ladies restroom, but I know in the men's restroom there are some urinals which are actually low enough so that somebody in a wheelchair can use it, right? So that is policy in various parts of the world. Now we don't have that policy yet in Ghana, and being handicapped in our country is difficult, right? And amongst the young, ischemic high morbidity. So you can imagine high morbidity for a long time, right? And the kind of burden that it can give to society. So really, if we sort our primary healthcare system so that we can pick out hypertension when it starts and treat it for free, then we are capable of, of, of preventing some strokes. And every one stroke that we can prevent is a young person who can be of better use to the society.
Wow. It's a bit discouraging, but I'm hoping that we're all learning and we'll work more on the preventive measures so that the prevalence will go down. So it's, yeah, a bitter pill to swallow. We all have to advise ourselves. It's so easy to lose sight of it.
Exactly.
Yeah. Okay. So our time is up. We'll like to wrap up here. I don't see any other comments or questions. And there's none here either. So I want to thank you so much, Teddy. As usual, it's been very informative.
My pleasure.
And I believe that we're all going to leave this place and, in quotes, behave ourselves. Sin no more.
Yes, please. Oh, God help.
God be our help.
Well. Amen.
Do you have any final remarks? Or?
I think we should. The big challenge for the future is non-communicable disease, and the top non-communicable disease in terms of causation of death will be stroke. And if we're going to impact the future, we should be thinking about how to diagnose and treat hypertension for free.
Okay. Thank you very much. So this has been the IMANI Reviews show. This is where we speak, we are real so that we can live. And tonight we've had Neurosurgeon Teddy Totimeh talking to us about stroke. Let's take this seriously. Let's have balanced diets. Let's, most importantly, be active. If your work is such that you sit down a lot, we've discussed it in the previous discussion about hypertension, that there are pockets of times you can take advantage of. Walk around, jog a bit, just do something that will keep your blood system flowing and your heart functioning well, so that we can prevent all these things. Like a friend of mine says, right now you don't want to get sick in Ghana. It's a pity, but that's the reality. So thank you once again, Teddy. God willing, we shall meet again another time.
Definitely.
But before we go, I have a few announcements. First of all, I want to remind us that if we haven't subscribed to the channel, the YouTube channel, please do so. Just type IMANI Reviews Show in your browser or in your YouTube browser, and the channel will open. You subscribe, and then you also share the link for others who want to join so that they can benefit from our discussions. Also, we are no longer using Zoom. I sent information earlier that I'm trying to improve the quality of the video, because God willing, we'll be sharing content with some TV stations, and they have a certain standard that they require. We realized that Zoom causes some significant delay between the sound and the video, so we've had to eliminate that. But it's been replaced by the second link I sent today, and it's quite simple to use. If you have any questions, you can reach out to me. I can walk you through how to use it, but it's similar to Zoom. It also has an interactive side to it. You can send in your chats. And thirdly and finally, I'm hoping to put together something like a picnic for the IMANI Reviews Show family sometime this December, tentatively December 30th. So please look at your schedule and you pin these dates down. God willing, we shall meet. I shall communicate the rest of the details later. I'm still fleshing things out and still planning, basically. but I want us to know, so we keep it at the back of our minds. We've met online for a long time. It will be good for us to see each other, get to know each other better as one family. So, yes, keep this in mind. So, thank you once again. It's been good meeting with you again another Monday and going through another discussion. God willing, we shall meet again next Monday. But before we go, I want to say a word of prayer. Teddy, are you still there? Okay. Can you please pray with us?
The truths that have been discussed, and I pray that you will use these in our lives. And Lord, grant us a good week. Enable us to keep trusting and obeying you. To you be all the glory. May your name be praised. In your Son Jesus' name. Amen.
Amen. Thank you very much. God willing, I'll see you all next Monday. Bye. Thank you. Bye.